Your body sends you whispers of trouble long before it ever has to scream. But what if you've been trained to ignore the very whisper that could save your life? This is a conversation about one of the most silent diseases there is. Most people will miss the single most overlooked clue we'll cover, a sign that can appear months, even years, before a diagnosis. And if you skip to the end, you might just miss the one message your body is desperately trying to send you. Please remember our conversation today is for awareness and education. It's a starting point to help you become a better partner with your healthcare team, not a replacement for their advice. Let's get started. Digestive distress. Have you ever had a pain that wasn't sharp or dramatic, but just there? A deep, persistent ache in your upper belly, almost like a constant heavy pressure that seems to wrap around to your back. It's the kind of discomfort you might try to stretch out or blame on bad posture or a heavy meal. For many, it seems to get a little worse after eating or when they lie down at night, and maybe leaning forward in a chair offers a moment of relief. This isn't just a random stomach ache. It's one of the most classic signs of a problem with the pancreas because a tumor can begin to press on surrounding nerves and organs, creating this unique gnawing sensation that just doesn't quit. You might be thinking, pain is subjective, right? But here's where it gets really interesting. Over 2 decades ago, researchers made a chilling discovery. They found that the type and intensity of this specific abdominal pain were directly linked to how advanced the cancer was. They looked at people with pancreatic tumors and separated them into groups based on their pain levels. The results were staggering and painted a very clear picture of just how important this one symptom is. It wasn't just about discomfort, it was a predictor of time. Imagine two people side by side, both with the same diagnosis. The person who reported having no significant pain had a median survival of 29 months, but the person experiencing severe, persistent abdominal pain had a median survival of only 9 months. That is a massive difference. And it wasn't because of their age or other health factors. It was driven by the pain itself, which signaled a larger, more invasive tumor. So, if you are experiencing a persistent abdominal pain that feels deep, radiates to your back, and doesn't have an obvious cause, please don't brush it aside. It's a critical message. It's your body asking for help in a language we absolutely must learn to understand. It's more than just a feeling, it's a vital piece of information. Now let's move from pain to another feeling we all know, hunger. Think about your favorite meal, the smell, the look, the memory of its taste. Now imagine sitting down to that very meal and the thought of taking a bite makes you feel nothing. Or even worse, it makes you feel slightly nauseous. This isn't just having an off day or not being in the mood to eat. It's a profound loss of appetite, and for many facing pancreatic cancer, it's a daily reality. The reason this happens is twofold, and it's a fascinating and cruel trick the body can play on itself. First, the pancreas is like the master food processor for your body. It produces essential enzymes that break down everything you eat. When a tumor disrupts this process, your body simply can't digest food properly. You're not absorbing nutrients. So, on a biological level, eating starts to feel pointless and unsatisfying. But there's a second, more sinister layer. Pancreatic tumors can release substances that essentially hijack your brain's command center for hunger. These substances mess with the delicate hormonal signals that tell you when you're hungry and when you're full. So you might feel completely full even if your stomach is empty. Your body's own hunger cues are being actively suppressed. This isn't a small issue. One major study found that a huge majority of people with pancreatic cancer, up to 85% of them, experience significant unintentional weight loss. This loss is almost always tied directly to this disappearing appetite and the body's inability to absorb what little food is eaten. It's a complex, cruel cycle where the cancer both steals your desire to eat and prevents your body from benefiting when you do. So, a persistent loss of appetite, especially when you start noticing the numbers on the scale drop without trying, is a major red flag. From appetite, let's talk about a feeling that's often just seen as an annoyance: bloating. That uncomfortable, tight, swollen sensation in your belly after a meal. We all get it from time to time from certain foods. But what if it started happening all the time? What if that feeling of being overly full and gassy just never seemed to go away, no matter how carefully you ate? This isn't just an inconvenience, it can be another signal from a struggling pancreas. When scientists in the San Francisco Bay Area conducted a comprehensive study, they stumbled upon a powerful clue. They found that about a quarter of pancreatic cancer patients remembered experiencing unusual and persistent bloating before their diagnosis. In the control group of healthy individuals, only 2% reported it. You might not be a statistician, but what this translated to was what they call an odds ratio of 20. In simple terms, this feeling of being constantly bloated was 20 times more common among those with pancreatic cancer. That's not a small difference, that's a loudspeaker announcement. So, what's going on? Again, it comes back to the pancreas and its role in digestion. Think of it like a traffic jam. When the tumor disrupts the flow of digestive enzymes, food can't break down efficiently, and it ends up sitting in your stomach for much longer than it should. This is called delayed gastric emptying, and it's what leads to that constant, persistent feeling of being bloated and full. If you're dealing with this kind of bloating that doesn't have a clear cause, don't just reach for an over the counter remedy and hope it goes away. See it as a persistent question your body is asking you. And often going hand in hand with that bloating is its close cousin, indigestion. That burning feeling, the burping, the general discomfort after eating. It's so common that most of us just dismiss it as a part of life. But when it lingers, when it becomes your new normal, it deserves a closer look. Tumors in the pancreas can physically press against the stomach or the beginning of the small intestine, which creates a bottleneck that disrupts the whole digestive process. Food backs up, leading to those classic feelings of indigestion. But researchers uncovered a crucial detail that many people miss. They published a study in a major medical journal that looked at the link between indigestion and pancreatic cancer risk. What they found might surprise you. People experiencing indigestion without the typical classic symptom of heartburn actually had a 3.8-fold increased risk. Think about that for a second. The risk was almost 4 times higher for those who had that vague, uncomfortable feeling of indigestion, but not the telltale burning of acid reflux. This specific clue often gets dismissed because it doesn't fit the classic profile of GERD or other common issues. So we have to be vigilant. We have to be detectives for our own bodies. Persistent indigestion, especially when it doesn't respond to the usual treatments or comes with any of the other signs we've talked about, is worth a conversation with your doctor. Early detection is a game of putting together subtle clues, and this is one of them: bathroom clues. All right, this next part of our conversation requires us to be a bit more direct. And I want you to know that it's a safe space to talk about things we normally don't. We're going to talk about what you might notice in the bathroom because these clues are incredibly important and often the most overlooked. Let's start with diarrhea. When your pancreas isn't working correctly, it can throw your entire digestive system into chaos. One of the most common ways this shows up is with frequent loose stools that can feel urgent and difficult to control. So, why does this happen? Let's use an analogy. Imagine your digestive system is a sophisticated factory assembly line. Its job is to take raw materials, food, and break them down into valuable, usable parts for your body. The pancreas is the manager that sends out the most important workers on this line, the digestive enzymes. These are the specialized workers that break down fats, proteins, and carbohydrates. Now, imagine a tumor is like a roadblock, blocking those essential enzyme workers from ever reaching the assembly line in your intestines. The entire system grinds to a halt. Without the workers to break it down, the food just rushes through the factory unprocessed and out the other end. That's what leads to diarrhea. Your body simply can't absorb the nutrients and everything moves through way too quickly. The importance of this symptom cannot be overstated. There's a well documented medical case highlighted in the American Journal of Gastroenterology where a patient's only symptom was persistent, unexplained diarrhea. They didn't have jaundice, they hadn't lost a lot of weight yet, they didn't have the classic abdominal pain. It was the diarrhea alone that led a smart doctor to investigate the pancreas and ultimately find the cancer. It can be the one single lonely alarm bell that your body rings. So if you're experiencing this consistently, it's not something to just tolerate. This brings us to the next. Very visual clue you might see in the toilet. And again, let's be open about this. You might notice that your stool has changed in its appearance. It might look unusually pale, almost clay colored, or it could appear greasy, oily, and have a tendency to float, making it difficult to flush. This condition has a medical name, steatorrhea, but all it really means is fat in the stool. This happens for the exact same reason we just discussed, a lack of digestive enzymes. Fat is the hardest thing for your body to break down, and it requires a full force effort from the pancreas. When those enzymes are blocked, the fat from your food goes completely undigested. It's like trying to mix oil and water in your gut. That undigested fat has to go somewhere, so it passes right through your system and out, causing those noticeable, visible changes in your stool. This isn't a subtle sign. A recent scientific review in 2024 pointed out a critical threshold. These kinds of fatty stools typically only start to happen when over 90% of the pancreas's ability to produce enzymes is gone. Let that sink in. This isn't a symptom of a pancreas that's having a minor issue. It's a sign that the organ has lost almost all of its power to help you digest food. It's a late stage signal of digestive failure, even if the cancer itself might be in an earlier stage. That's why paying attention to what's in the bowl is so critical. It's your body giving you a direct physical piece of evidence that a core part of your digestive machinery is broken. Noticing this change and telling your doctor about it is one of the most proactive steps you can possibly take. Now, you might be thinking, wait a minute, you just spent all this time talking about diarrhea. How on earth can constipation also be a sign? That is a fantastic question, and it highlights just how complex the pancreas is and how its malfunction can create problems at both ends of the spectrum. Yes, constipation can also be a symptom. In this case, the digestive disruption caused by the tumor can sometimes lead to a slowing down of the whole system. The movement of food through your intestines becomes sluggish, which gives the bowel more time to absorb water from the stool. The result is harder, drier stools that are difficult to pass. There's another layer here, too. The abdominal pain that often comes with pancreatic cancer may require strong pain medications, particularly opioids, which are notorious for causing constipation and making the problem even worse. But this is where the science gets really fascinating and takes an unexpected turn. A brand new study from 2024 used a very powerful type of genetic analysis. It's called Mendelian randomization, but think of it as a way for scientists to look for true cause and effect relationships in huge populations. They found a potential causal link between having chronic constipation and an increased risk of developing pancreatic cancer. The data suggested a 56% increased risk. This is groundbreaking because it suggests that long term constipation might not just be a symptom that appears after the cancer develops, but that the state of chronic constipation itself, perhaps the inflammation or changes to the gut microbiome it causes, could be a factor that contributes to the risk of the cancer developing in the first place. This is an emerging area of research, but it completely changes how we should view a condition that so many people suffer from in silence. Persistent chronic constipation is more than an inconvenience. It's a state of dysfunction in the gut that absolutely deserves medical attention. Body changes. Now we're going to shift our focus away from the digestive system and look at changes that can happen to your body as a whole. And the first one is one of the most serious and emotionally devastating. It's called muscle wasting or cachexia. I want to be very clear. This is not about losing a few pounds to fit into your old jeans. This is a completely different kind of weight loss. It's an involuntary, profound loss of weight that primarily comes from your muscles. It's the kind of weight loss that feels like it's stealing your strength from your very core, leaving you feeling weak, frail, and exhausted. And what's truly alarming about this is that it's not just a late stage symptom. It can be one of the very first signs, appearing long before a formal diagnosis is even considered. A groundbreaking study published in 2023 in the prestigious journal Nature Communications made a shocking finding. Using advanced imaging, they found that this skeletal muscle loss could actually be detected on scans up to 18 months, a year and a half, before a person was officially diagnosed with pancreatic cancer. This tells us that muscle wasting isn't just a side effect of being sick, it's an early active process driven by the cancer itself. You might be wondering, Why does this happen? The tumor is like a rogue factory, releasing certain substances into your bloodstream that wreak havoc on your body's normal metabolism. One specific substance scientists have identified is called PAOF, and research has shown that this substance can directly trigger muscle cells to break down and wither away. It's like the tumor is sending a self destruct signal directly to your muscles. This isn't just about feeling weak or looking thinner. This loss of muscle is directly linked to poorer outcomes and reduced survival rates. It affects quality of life, it affects your ability to tolerate treatments, and it's a critical sign that the body is in a state of crisis. Unexplained weight loss, especially when you can see and feel you are losing muscle mass, is one of the loudest alarm bells your body can ring. Next is a change you might notice just by looking in the mirror. It's a subtle shift in the color of your skin or the whites of your eyes. They may start to take on a yellowish or sometimes even a pale grayish hue. This is a classic sign known as jaundice. And this is another plumbing problem. Your liver produces a substance called bile, which helps with digestion, and it stores it in the gallbladder. Bile contains a yellow pigment called bilirubin. A small tube called the bile duct carries this bile from the liver and gallbladder past the pancreas and into the small intestine. Now imagine a tumor in the head of the pancreas, the most common location, starts to grow and press on that tiny bile duct. It's like a foot stepping on a garden hose. The flow is blocked. The bile, with its yellow bilirubin, has nowhere to go, so it backs up into the bloodstream. As bilirubin levels rise in your blood, it starts to get deposited in your skin and your eyes, causing that signature yellowish tint. This is often one of the first, most unmissable signs of pancreatic cancer, and it's what drives many people to the doctor. One major study confirmed that jaundice and other symptoms of this bile duct blockage, which also includes those pale colored stools we talked about and very dark tea colored urine, were extremely common and occurred far more frequently among patients than in healthy individuals. It's a very clear cut indicator that something is physically blocking that crucial drainage system. So, if you or a loved one notices any kind of yellowing in the eyes or skin, there is no waiting. There is no wait and see. It warrants an immediate call to your doctor. It's an unambiguous signal that something is wrong. Now let's talk about a diagnosis that affects millions and millions of people, but that can sometimes hide a different story. For a person over the age of 50, being newly diagnosed with diabetes is a life changing but common event. It's usually assumed to be standard type 2 diabetes, but in a small but significant number of cases, this sudden onset of diabetes can actually be the body's first major warning sign of an underlying pancreatic cancer. This happens because the pancreas has two main jobs. We've talked a lot about its digestive role, but its other critical job is to produce insulin, the hormone that controls your blood sugar. A tumor can disrupt or destroy the insulin producing cells in the pancreas, leading to suddenly high blood sugar levels and a new diagnosis of diabetes. Research has quantified this risk. While it is rare, the numbers are important. For individuals over 50 who are diagnosed with new onset diabetes, approximately 1 in 125 of them may have an underlying undiagnosed pancreatic cancer. That risk is dramatically higher than in the general population. But here's the statistic that should make everyone pause. About 25%, one quarter, of all people diagnosed with pancreatic cancer had actually been diagnosed with diabetes within the 3 years prior to their cancer diagnosis. This strongly suggests that in many of these cases, it was the hidden growing cancer that was causing the diabetes, not the other way around. This link is so strong that scientists are now actively trying to develop screening methods to identify which new diabetes cases are most likely to be cancer related. So, for anyone over 50, a new diabetes diagnosis, especially if it's paired with unexplained weight loss or any other symptoms, should immediately trigger a deeper conversation with your doctor about your pancreatic health. Let's touch on one more sign in this section, and it's one that might seem strange: a fever. We're all taught from a young age that a fever means your body is fighting an infection like a cold or the flu. But what happens when you have a persistent low grade fever day after day and there's no sign of infection whatsoever? In rare cases, this can be the body's immune system responding directly to the cancer itself. It's a phenomenon called neoplastic fever. There is a fascinating documented medical case of a patient whose one and only primary symptom of their pancreatic cancer was a recurring fever. Doctors were stumped. They ran every test looking for an infection and found nothing. It was only after extensive investigation that they discovered the tumor. And here's the most telling part: 4 days after the tumor was surgically removed, the fever vanished completely, and during a 39-month follow up, it never came back. The fever was being caused directly by the cancer. While this is not a common presentation, a very large scale study analyzing Danish health records backed this up, finding that unexplained fever was one of the significant symptoms reported in the 5 years leading up to a pancreatic cancer diagnosis. It's another quiet, unusual clue that something systemic is going on inside the body. Hidden signals. We're now moving into the final and perhaps most subtle category of symptoms: the hidden signals. These are the clues that can seem completely unrelated to the pancreas, which is why they are so often missed. And the first one can be a real life medical detective story. Sometimes, the very first sign that something is terribly wrong in the body appears as a blood clot, and it's often not in the legs, where we typically think of them. This is a phenomenon known as Trousseau's syndrome, where blood clots form in unusual places like the veins of the arms, the chest, or the abdomen, and they have a strange tendency to recur or even migrate, appearing in one place, disappearing, and then showing up somewhere else. Why does this happen? We now know that many cancers, and pancreatic cancer in particular, create what's called a hypercoagulable state. The cancer releases chemicals into the blood that make it stickier and more prone to clotting. For some people, a sudden unexplained blood clot is the check engine light that leads to their diagnosis. A 2024 study that analyzed records from over 4,000 patients found that a significant number of them had experienced one of these blood clots in the year before their cancer was even discovered. It was the precursor, it was the warning sign that came before any of the digestive issues. What's more, the study confirmed that the presence of these blood clots was associated with worse survival outcomes, highlighting just how serious this signal is. It indicates a more aggressive biology of the cancer itself. So, if you or someone you know develops a blood clot without any of the usual risk factors, like recent surgery, long haul travel, or a known clotting disorder, it should be investigated thoroughly. It could be the first and only clue to something happening much deeper inside. Let's talk about an organ you'd never think is related: your skin. Imagine having an itch. But this isn't the kind of simple, dry skin itch that you can fix with a good moisturizer. This is a deep, relentless, maddening itch that seems to come from the inside out. It can be all over your body, and scratching brings no relief. And this type of severe itching is called pruritus. And when it's connected to the pancreas, it often signals that same plumbing problem we talked about earlier with jaundice. When the bile duct is blocked by a tumor, it's not just the yellow pigment bilirubin that backs up into your blood. Bile acids and other substances also accumulate. These substances circulate throughout your body and can directly irritate the tiny nerve endings in your skin, triggering that awful, nonstop itching sensation. Scientists have recently drilled down even deeper into this mechanism. A 2024 review pointed to a specific enzyme called autotaxin as a key player. This enzyme's levels go way up when bile flow is blocked, and it produces a compound that specifically activates the itch sensing nerve fibers in your skin. It's essentially flipping your body's itch switch to the on position, and it won't turn off. This is also why the usual remedies like antihistamine pills often do absolutely nothing for this kind of itch. The problem isn't histamine like in an allergic reaction. The problem is a biochemical cascade triggered by the blockage. The only things that truly help are procedures to unblock the bile duct or newer medications that target that specific enzyme pathway. Persistent, severe itching without a rash or obvious skin condition is a huge clue that the problem isn't skin deep. And that brings us to the symptom that I mentioned at the very beginning of our conversation. The one that is so incredibly common, it's almost always dismissed by everyone. including patients and sometimes even doctors. I am talking about fatigue. But I need you to understand this is not "I'm tired from a long week" fatigue. This is a bone deep, soul crushing exhaustion that no amount of sleep can fix. It's a profound, persistent lack of physical and mental energy that completely disrupts your ability to live your daily life. Many people who have experienced it describe it as feeling like they're walking through wet cement every single day. One powerful study conducted at an Italian oncology center really put a number on this. They found that 94%, almost every single pancreatic cancer patient they studied, reported experiencing this kind of severe, life altering fatigue. Older adults and women in the study reported even higher levels of it. This overwhelming exhaustion stems from a 1 2 punch. First, the cancer itself is like a parasite consuming your body's energy and resources. It also releases those inflammatory substances that disrupt normal functions and just make you feel unwell. The second punch comes from the side effects of the disease and its treatments like anemia or poor nutrition, which can make the fatigue even worse. This is not a symptom to be brave about. This is not something to just push through. When you are experiencing a level of exhaustion that is completely out of character for you, that doesn't get better with rest, and that lasts for weeks on end, it is a significant medical event. It's your body's energy reserves sounding a five-alarm fire. And that leads us right into our final point, which is perhaps the most difficult one to pin down of all. It's a feeling often described by the French word malaise. It doesn't mean you're sick in a specific way. It doesn't mean you're in pain. It just means feeling unwell. It's that persistent, vague, nagging sense that something inside you just isn't right. You're not yourself. You feel drained, out of sorts, and you can't put your finger on why because it's so nonspecific. It's the easiest symptom in the world to dismiss. You might blame it on stress, bad sleep, or just getting older. But multiple large scale studies have shown that we must not ignore this feeling. A huge study from Denmark analyzing over 25,000 cases found that this general malaise and fatigue were some of the most commonly reported symptoms right after a diagnosis. They were real, they were prevalent, and they were part of the clinical picture. Even more telling, a separate UK study found that when a patient presented to their doctor with just this vague feeling of malaise, their likelihood of ultimately being diagnosed with pancreatic cancer was 2.4 times higher compared to patients without that symptom. This shows that this subtle general feeling of unwellness is a real and measurable part of the symptom pattern. It's a whisper from your body, but a persistent one. When that feeling lingers, especially in anyone over 60, it absolutely needs to be a trigger for a deeper medical evaluation. It's the accumulation of these small, subtle signs that can eventually paint a clear picture. Listening to your body isn't about being fearful, it's about being wise. It's about cultivating a partnership with yourself, a deep relationship of trust where you choose to honor the subtle messages and whispers it sends you every single day. These signs, a persistent ache that has no name, a change in your daily digestion, a fatigue that sleep cannot cure, or just that nagging feeling that something is off, they are not meant to create anxiety. They are invitations. They are invitations to pay attention, to ask better questions, and to become your own most powerful advocate on your health journey. Knowledge is meant to create not fear, but informed action. Share this video with someone you love. It might be the most important conversation you have all week.